All right, so this morning we're prioritizing mental health in economically challenging times. There's no soothsayer, or perhaps we do not need any soothsayer to let us know that these are very, very tough times for Nigerians. And the result of that, or perhaps the resultant effect of what's going on out there, is that people fall into mental health issues. We have people who are falling into depression, others coming down with various kinds of mental illness, and some, they're not things that you can really spot easily. And that's why we brought in a consultant this morning to help us understand all of this, put the bits and pieces together, and let's see how we can stay healthy all through these challenging times. So joining me in the studio this morning, I have Dr. Olufumilayo Akionla, who is consultant psychiatrist with the Federal Neuropsychiatric Hospital at the Annex in Oshodi. Madam, nice to have you back in the studios. Good morning, ma'am.
Good morning, sir. Thank you for having me.
It's been quite a while, really.
Yeah.
What do you make of our studios right now? Look to your left.
Beautiful. Good.
Beautiful.
Yeah.
All right, Dr. Akionla, let's begin by putting our subject matter into some realms, some context, right? These are very, very tough times, like I did say earlier on, and many things crop up into our mental well-being. So how do the economy, and I'm looking at how economically challenging times like this, how does it affect our mental health?
Well, thank you for that question. I think I should first of all start by saying what our mental health is. Okay, so mental health is a state of well-being,
right?
Okay, that enables people to cope with the stresses of life and to realize their abilities, learn well, work well, and contribute to their community.
State of well-being, right?
Yes.
That helps us to cope with
stresses of life. So that's what that's what we're talking about this morning, the
right.
challenges of life, particularly economical challenges.
Yes.
And we must remember that it's not only in Nigeria, so we shouldn't feel so distressed.
So it's a global phenomenon.
It is a global phenomenon, but for us in Nigeria, so how are we going to cope? I think that's what we want to talk about this morning.
Right.
So, yes, in challenging times like now, because it's economical, so things happen, employment, whether even the money you get now is not even enough to do all that you need to do. So the bills keep piling up and all that. So what it does is it increases the stress level in people. And obviously this can lead to more of anxiety disorders, depression, substance use, because when people are not happy, particularly men, they tend to use substances.
So you are affirming Riri's point that men are like...
No, that's not what I'm saying. Everybody is prone to have a mental illness, but we respond to issues in life different ways, male and females. So because men, they are just being taught now that you need to speak out, maybe the younger generation. So the older ones, you internalize, then you begin to take substances. So, but the idea is substances, you can't use evil to treat another evil. Because you drink, you get drunk, you wake up in the morning, the problem is still there. Even if you smoke Indian hemp, Colorado, whatever that you are smoking.
So it can't take away...
It can't take away the problem. So what do we do about it? So the issue is, how do we learn to cope with what is going on now?
Right.
So there are going to be increases in all these things. Suicide attempts or thoughts might also increase, because when people think about it, that it seems there's no way out. Then they might begin to think about taking their own lives.
And what you see, some of the most common mental health issues that are faced by Nigerians during this period, what are they?
Anxiety and depression.
Those are the two.
Those are the common. We say these things are endemic in the community.
Wow.
And it is unfortunate that most times they don't even know where to go. They don't realize what is going on with them. Then they don't seek help on time.
Right. So people that present at the clinic or at your hospital now, so out of 10, 8 of them will come down with anxiety and depression?
No, it's not that bad. We say, they say depression is like 3.9% in Nigeria, but it differs in different subgroups. But we say for depression, maybe if you have a room of 10 people, maybe 2 to 4 of them might have depressive symptoms. So it can't be that. But I think the most important thing is, life is hard now,
right?
And it is quite endemic there. And it's not just about economic. Even the younger ones, stress of getting into schools, of getting the courses that they want, all these too leads to emotional problems.
Right.
in the adolescence.
I have heard young ones, some of them say, I am depressed. Is it possible for a young person to be depressed? 12 years, 13 years, 14 years?
Definitely. Depression is an emotional illness. I've heard about a 10-year-old that got depressed because the mother had a new baby and all the attention was on the new baby.
Wow.
And so he felt left out. So that's why we advise mothers, particularly if there's
So is that depression? That would
if somebody is unhappy, you don't want to do the things you do. Yeah, I mean, what's depression, sir? It's a mood disorder.
Okay.
And it involves an individual won't be able to cope with all the things that are going on in their minds. They feel they can't solve issues that they have. It can be caused by anything.
Right.
So, I mean, that was the trigger. And they kept on going down that nobody loves me. All the attention is on the new baby.
Wow.
And the grades start falling in school. And I stop sleeping very well. And so
it's possible.
It is absolutely possible.
Right.
Yeah.
So is there anything like absolute mental health that is complete? Can somebody have 100%?
So we say mental health is like a continuum, a spectrum. So you can't, sometimes when we talk about people, for example, depression, we say on a scale of 1 to 10, where do you think your mood is right now? So if it is low, we talk about the normal distribution curve. Everybody's supposed to be at the middle. Of course, you always have outliers. So when you ask the client on a scale of 1 to 10, where do you think your mood is now? So so we are saying everybody should be around 5,
right.
4, 5, 6. That should be the normal level. So if it's now going below that or it's going above that, you're talking about a manic episode, too happy.
Right.
And so all that. So it's not that at every point in time your mental health is 100%.
Right.
But not that is low too.
Yes.
But you can have episodes that you're not happy. You're not sleeping well, you have issues at work, you have issues with your children, you have issues with your partner, your spouse,
right?
But it's not supposed to affect your functioning.
Right. Once upon a time, about 21 years ago, I remember a survey said Nigerians are the happiest people in the world. I'm sure that description will not fit us these days, but when you assess Nigeria generally in terms of the mental health status that we have right now, Dr. Akinola, how would you rate it? When you look at things that are going on around?
According to WHO, it says like about maybe 40 million Nigerians have one form of mental illness or the other. And like I said, it's not only Nigeria that we have economic challenges. So people in different nations they have issues. So, but for us, it might be difficult because if you look at our history and how the things are going on, so it might be quite challenging for us that when will we ever get back onto the way that we were before?
Let's talk about stigma in all of this, because I know that when we are talking of mental health, but even before we talk about stigma now, so let's bring it to issues of mental illness.
Yes.
So there is mental health, which you have defined for us.
Yeah.
So what is mental illness?
So like I said, all those significant points, stresses, if an individual cannot cope with the stresses in his or her life, they cannot realize their ability, they are not learning well. Children in school, even in your office, you are not meeting deadlines, you can't work well, and you can't contribute to your community. So when we talk about mental health, we talk about the thinking, the thoughts, the attitude you put to situations around you, and ultimately how you behave. So when there's anything wrong at these different points, then we begin to think about there's something wrong with that individual's mental health.
Right.
And so that's why I will say one of the most significant symptoms of mental illness is when there's a change in behavior. So you do not, keep quiet if you notice it in somebody that is close to you. And even if you notice it in yourself, you're no longer sleeping well, your ability to think, to plan and to accomplish is going down daily.
Right.
So we are not saying that, yes, you have mental illness, but something is definitely going on. So we encourage people to present early. We always talk about prevention.
Right.
We talk about early identification, then treatment to prevent disability.
So what are the types of mental illness
so we have minor, we'll have the ones that we call minor mental illnesses. We have the major ones. So, like I said, the minor ones, the typical example are the anxieties, the anxiety disorders,
Okay.
depression, somatoform. When the individual is concerned with maybe, my nose is too big. So I have to do something
Or
about
people
it.
are saying, I am dark.
I am dark, so I need to become white.
Right.
And things that everybody sees that there's nothing wrong, but the individual believes that there's something wrong, either with their body form, structures, and all that.
So that could be a mental disorder?
If everybody will measure your nose and we know it's okay, but you keep insisting my nose is not okay. So that's not normal.
Okay.
So that's, the commonest example that can readily come to mind.
Right.
So those are the common ones. Then the major ones are like when we say psychotic illness, for example, schizophrenia. Okay, so we do know that those are not really common. It's like 0.91% of the population. So that's why we say the mood disorders are commoner, and most times they're endemic in the community. Okay. So and that's why we encourage people to come forward. And
right.
Yes.
So what do you call that?
Schizophrenia. Yes. It's an example of a major psychiatric illness.
Right. What's this one called? Extreme mood swings. What's that one called?
So that's bipolar.
Bipolar, yes.
Yeah. So bipolar is another example because it's quite. It could be quite disruptive. So we must remember that when we talk about mental illness, the functioning of that individual will be affected. So we are talking about functioning at home, functioning at work,
right,
and in the community where the person lives, whether in the marketplace or in the religious circle. So you don't just look at an individual in one sphere of life. You tend to look at them globally so that you can now say, okay, so something might be wrong with this person.
Okay, so there's a common term that we use a lot when you see people on the street that perhaps have lost their mind, so to say.
Yes.
We use the term mad, right? Which is definitely
not acceptable.
Not acceptable.
Yes.
Okay, what about lunatics? Is that acceptable?
No.
It's not. Okay, so at what point?
So you say it's somebody that has maybe mental health issues. That is,
right.
so we are trying to remove the stigma.
The stigma that is.
Yes.
We'll talk about that stigma as well. But those ones that are on the road or on the streets that you see them, probably they've lost their mind, so to say. So what do you think would have been responsible for that? At what point?
So many things.
Okay.
So, we usually say that most times it's not just one cause. It's usually cause of mental illness. It's usually a combination of so many factors. And so anything could have gone wrong. And maybe attention was not paid to it on time. For example, for those that you find them on the streets, most times it's usually a major psychiatric illness. And so when it's associated with auditory hallucinations, that is hearing voices of people they can't see, they'll just say, walk out of the house, and they'll just walk. Some of them, they are not even here. There's one that we see in our environment. Sometimes we see him for days, then sometimes for months it would disappear.
Right.
And there was a day somebody told me that he went to Ibadan and he actually saw him at the toll gate. So that means he walks between Lagos and Ibadan.
Wow.
So those days or months when we don't see him, then that means he had walked somewhere else.
Right.
So all the way to Ibadan. Then maybe the voices will tell him again, go back to where, and we'll walk all the way back to Lagos. So these are issues. So they leave and their relatives are looking for them most times.
Right.
They don't know where they are until maybe somebody that knows them will say, I saw this person at this place.
Particular place.
Yes.
So let's talk about the stigma that is attached to mental illness in Nigeria. So that stigma is, I don't know how to describe it.
Well, when we talk about stigma, we have personal stigma and external one that people put. Then people that even have mental illness too tend to, feel what people say because of course, your attitude, your beliefs about life. You pick it up from where you are raised and the culture that you live in. So over the years, they know that somebody with mental illness is usually not appreciated or helped. Why? Because we as a people would do most times before.
All right.
We did not understand the sources and the causes of mental illness. So when you don't understand the origin of something, you tend to externalize it. And so that's why it's believed that it's caused by witches, your grandmother's stepwife and all that.
Right.
So nobody wants to. So there's usually this...
But doctor, it's not possible.
I am a
Don't you have
scientist.
witches?
We'll come another day to talk about that, sir.
Okay.
So there's internal stigma because people don't want to talk about it early, about what they're feeling, what is going on in their mind. Then the external ones, stigma simply means like stigmata, something that you have a mark on you. Aha. So, and it's still endemic and that's why one of the reasons that we do advocacy, that I'm here this morning.
All right.
So to let people know that and mental illness can happen to anybody. It's not a respecter of anything.
Anybody.
Whether you are rich, you are poor, you are middle class, you are old, you are young, you are middle age. Because there's so many causes, structural things can happen. Hit your head, road traffic accident, medications that you take can cause it, high fever. So it can happen to anybody. Okay. So we're saying that please don't, once you know that something, you just know that you're not, thinking well, you're not sleeping well, you can't undo the things you used to undo very well anymore.
Right.
So don't sit there. It's always better to go for these assessment early, and we can nip it in the bud.
Okay.
Before it becomes a diagnosis.
All right, then we'll touch more on that one. Lagos Traffic Radio 96.1 FM. Talk Time is a program, and I have Dr. Olufumilayo Akinola. She's a consultant psychiatrist with the Federal Neuropsychiatric Hospital right here in Lagos. She's at the annex in Oshodi. All right, let's get back to the roads this morning and let you in that the Okpebi Allen Corridor movement on Obafemi Awolowo Way from Radio Junction inwards Allen intersection down to Ikeja underneath the bridge, looking pretty good. Likewise, for the return journey, Aromire in and out of Allen intersection is also very much in good shape. Kudirat Abiola Way from Ojota inwards Welfare Junction, connecting Ikosi Junction down to Radio Junction, also looking pretty good to go at the moment. And we can tell you areas like Okpebi Link Bridge in and out of Welfare Junction, also looking very good. Okpebi Road from Sheraton Link Bridge in towards Salvation and Okpebi Roundabout down to Allen intersection, all looking pretty good. Likewise for the return journey. So we can tell you all those areas are still looking good this morning. Ikorodu Road is also faring pretty well. Vehicular movement is looking very good in and out of Odogunyo, that's the inner part of Ikorodu. Traffic inwards Flower, second gate and first Lasutech gates, as well as Okegbegun and the Sawmill inwards Last Mile Yard, High School, Ilekpo, and up to Sabo Roundabout, all looking very, very good this morning. All right, Dr. Akinola, let's touch more on the causes of mental illness. What are the major causes?
Well, like I said, different causes. Some of them could be heritable, so that means it runs in families. Yes.
So it's hereditary too?
Yeah. Some of them, yes, some of them.
Okay.
Then, like I said, accident, trauma to the brain. Sometimes medication. We've had, one or two that can trigger it. So infections.
Okay.
Then just life stressors. But, we talk about nurture. So we talk about the genetic makeup of that individual. We talk about the environment. So when environment meets the genetic composition, then anything can happen. So maybe a damage happened when that child was a baby.
All right.
But it wasn't, so of course it won't be pronounced. But later on in life, you now have a stressor. It may be marital problems or problems with school, studying, and all that. Then it can trigger it. So that's why we say it's usually not a combination. So when we'll do assessment, we have to go around that individual's life, starting from even when that child was in utero, when that individual was in utero. So we never say never in medicine.
Right.
So anything can trigger it.
Okay, so a pregnant woman who's taking, let's say, alcohol, can that lead to?
Definitely, it can lead damage to the baby. We have alcoholic fetus syndrome.
Okay.
So it can affect the baby. So the baby can come out with withdrawal symptoms.
Wow.
I can't, so even the medic substance, children that use substances.
Right. All those substances that people use out there now.
Indian hemp, the Colorado. The Colorado is particularly bad because it is synthetic.
There's one they call loud now.
Oh, all of them. So they affect particularly for the young brains.
Right.
So these can cause development of mental illness. So, and that's why we say, why do you have to? You have issues. I don't think there's anybody under the sun that does not have issues. So we must learn to cope with our problems, learn to seek for help, and take counseling. Don't keep things to yourself.
Right.
But using substances is not going to solve it. Rather, it compounds the problem.
So let's talk about the common signs and the symptoms that we show that somebody is having mental illness. What are they, doctor?
So like I said, number one that I believe that is significant, let me put it that way, is change in behavior. Okay? So you see somebody that is, very active at home, discusses, moves with everybody, then suddenly the individual does not come out of the room anymore. He doesn't want to talk. We say keeping to self. You ask, the person is irritable, or you hear the individual in the house wakes up in the night and he's praying. I'm not saying prayer is wrong.
Right.
But, there's always a normal, that, okay, this person wakes up 12 to 1. Normally.
Yeah.
And nobody hears what he or she is praying about. But suddenly, this individual is no more sleeping at night.
He's now shouting.
He's now shouting that he wants to wash at night at 2 a.m. Is that normal? We are not talking about you dropping it inside the washing machine and going back to bed. But, they want to clean the house at odd hours.
Or you want to do exercise
by
2 a.m.
I mean, you're supposed to be sleeping. So you're supposed to do your exercise before you go to bed, or you wake up early in the morning and do the exercises, isn't it?
Right.
So, change. But what we are talking about is changing the habits and the personality of that individual.
Yeah, but let's look at this, doctor. A lot of people, especially the adults, a lot of people these days, they find it hard to sleep. I mean, once they do like 10 to 12, they wake up and it now becomes very, very, very problematic sleeping. So are you saying they are coming down with some form of mental health? Talk to me.
No, that's not what I'm saying. But we do know that you're supposed to sleep at night.
Okay.
So when people come to us and they say, I can't sleep. So the first question is, why can't you sleep? Then we must remember that we have things that we call sleep hygiene, your environment. So why do you wake up at 10, 2 a.m. that you can't sleep? Is it because of the temperature of the room? Is it because of the noise of the generator around you? Because they take electricity, then all your neighbors will put on their loud generators. You can't sleep. Or is it that there's something troubling you? So there's so many issues. So I have a client now that is saying she can't sleep, she's on medication, antidepressant. But once it's 12 or from 11, the individual is on the phone. We all know the effect of the blue light of our phones. Once you pick up your phone, your brain is going to come alert. It will become alert. You can't sleep because you're now concentrating on what you are reading, what you are seeing. And these are the things we should ask ourselves. So all the things that you look at, how does it improve your life? So all those TikTok, all those Instagram videos,
right?
Do you actually learn anything? And so before you know it, 2 hours has gone. Then it's going to be 3 a.m., 4 a.m. You're thinking of getting up to go to work.
Right.
So we must be able to prioritize what are the things that are important to us.
All right, let's see if we can expand the discourse beyond the studios to also have inputs this morning. You also want to be part of this program this morning. We're talking how to prioritize our health, our mental health during these economically challenging times. And Dr. Olufumilayo Akinola is taking us to the classroom. You want to ask any question or perhaps contribute to what we've been discussing, feel free. And that's on 091 5387 7127. 091-5387-7127, or you can also send your message to 080-99-120-777. Okay, that's 080-99-120-777. One here says, good morning, Mr. Victor, and the psychologist.
Psychiatrist.
He's a psychiatrist, so no psychologist. He said, please, what about postpartum depression? Can it be considered a mental disorder? Faye is sending this one in from Aurelia Faye. Thank you so much. So is that a...
Yes, and yes, and yes. So postpartum depression or psychotic illness is a mental illness. So please don't keep it in the house. Once you know that, a new mother, she's not sleeping well, she doesn't want to look at the child, she's not taking care of the child, she's either keeping to herself or talking, what she's saying does not make sense. You just know that there's something wrong with this woman, but you don't know what. Please bring her. Why? You know why it is so important that you get them to the hospital as soon as possible? Because of the newborn baby. Because, for example, if it becomes complicated, she's hearing voices of people she can't see. We've heard about people that will actually kill the baby, they kill themselves.
Wow.
So it can't, so we do not, please, I'm encouraging everybody, don't keep these things at home. Go to the hospital. It's always better.
All right. This one says, good morning, Victor. Happy new week. It's not a new week yet, too. It said, when should someone consider seeing a psychiatrist versus a psychologist or therapist? Temitayo from Apapa. All right. So what's the difference, really? Who's one supposed to see?
We have different types. Okay. So a psychiatrist is a medical doctor that specializes in psychiatry. A psychology deals with the behavior, normal, abnormal behavior. Therapists, I don't know, a therapist can, counseling and all that. Right.
So when we suspect that anybody is coming down with mental illness in our compound, who should you come to first? Is it the psychologist or you, the psychiatrist?
You can go to the doctor. So the doctor will do the assessment and said, oh, you are definitely going to need a therapist. So do you need medication? Is it only counseling that you need? Okay, so we need to do assessment. Is it a personality disorder? So go to the psychologist. So really, we work as a team, because sometimes if the individual is so bad, it's psychotic, there's nothing the psychologist or the therapist is going to say that individual is going to hear. So the doctor is supposed to clear it first with medication and all that,
right,
therapy. So when you get that individual to a level that he can comprehend what's going on around him, then the psychologists, the therapists, the counselors, everybody can come in.
Dr. Kinla, is mental illness curable? Tough question, right?
Yeah. But the important thing is it is treatable, it is manageable. Like all chronic illnesses, hypertension, diabetes, get to it early.
Right.
It can be managed. The important thing is it can be treated, it can be managed, that individuals will live normal lives.
So it's not curable.
As much as possible. I told you
you don't want to be categorical about it.
Yeah, because it's due to, for example, if it's due to a high, a fever, anything that can cause high fever, and the person breaks down, there's a likelihood, and you follow doctor's instruction, get to the hospital on time, you are treated, it is likely that person will not have another episode. If it is, for example, now a seizure disorder, that's like epilepsy, it's now complicated with behavioral manifestation and all that. Remember that most times, not all the time, most times, epilepsy will have a structural damage in the brain.
All right.
So how are we going to correct that? So that person most likely will be on medication for a while. So that's why it depends on the cause of the breakdown, the mental breakdown. So that's why it can be managed, but people must accept that they have issues, use medication, follow their doctor's instruction, and they will do well and go on with their lives.
There's one that is the junior brother of epilepsy. What's that one called? It's a kind of seizure too.
What's it?
I just can't
remember
it right now. All right, this one said
convulsion.
Convulsion. No.
Convulsion is a symptom of.
Yeah, that's not. This one here says. By the way, you can also join the conversation 080-99-120-777 and 09153-877127. This one says, good morning. It says, something is affecting this. Okay. It says, good morning. Are there warning signs families should look for in loved ones who may need professional help?
Yes.
You didn't put your name. Thank you so much.
Okay, so I didn't finish talking about the symptoms. Symptoms are the things that you see, not what the person is complaining about. So, for example, poor sleep, like I was saying, the person has stopped eating. Suddenly the person will say, I don't want to eat in the house. And you start wondering what's going on. I think the food is poison, Then they'll start buying food outside. The person that used to be so clean, meticulous, well-groomed Then you find out they keep to themselves. Their rooms are dirty. They don't bring out dirty plates. They put it under the bed. They don't want to take their bath a week. They won't change their clothing. So these are things that when you're talking A, they'll go to W. So what they're saying does not, in fact, you see them talking to themselves. Once you see somebody sitting down and talking, or some you hold the phone, but you're conversing. Some as if they're in a conference and they're really conversing. You wake up, I know about a wife that's dead. The husband will wake up in the night and will be talking, conversing as if he's in a conference, you know. So these are abnormal behaviors. So don't let it extend. But you don't say you are crazy, you have to go and say no. So what are the things on your mind? What are the things that are bothering you? So if you can't talk to us, so let's go look for somebody that you'll be comfortable with to be able to open up. So that's how you encourage them to seek for professional help.
All right.
Yes.
And in terms of managing or treating, is it cost effective?
Definitely, if you come in early. I know, like every other thing, if the person is now disruptive, wants to pull down the house, has broken all the windows, you know they are not going to, most likely we will not use just one medication to calm that individual. So they are going to use multiple things. The admission will be involved. But if they come in early, the person is not sleeping, is crying uncomfortably. 1 second the person is smiling, the next is crying, very irritable, cannot sleep, have a lot of energy. Come in early. Then what we are going to use to manage and treat that person will be less than when it's now totally disruptive. So it is cost effective. Yes.
Let's take this call. Hello there. Good morning.
Hello, good morning, Victor.
Yeah, good morning.
Comrade Daniel Onobume is on the line.
Oh, nice to hear from you, Comrade Daniel. How are you doing?
I'm good, and you?
Very good, too. So I have Dr. Akinola in the studios.
Yes, good morning, Dr. Funlayo.
Good morning, sir.
Dr.
How are you
Funlayo.
today? Yes, thank you.
Okay. Yes, my question is that can mental health disorder be triggered by the loss of a loved one?
Definitely, sir.
And secondly, my other question is that are mental health treatment cheap to treat like just ordinary malaria? That is my question this morning.
All right.
Thank you very much.
Thank you so much. Can it be triggered by the loss of somebody?
Definitely. When we talk about mood disorders, we have like a list, like a ranking. And on the top of that list is the loss of a spouse that can trigger particularly depression.
All right, let's take this call. Hello there, good morning.
Hello, good morning.
Good morning.
Yes, this is Sean.
Sean, how are you doing?
I'm very good.
All right. Where are you calling from, Sean?
I'm calling from Alapere.
Oh, go ahead, Sean.
All right. So, I want to say, I have a relative, an uncle, who is he lives a normal life. He's successful, lives a normal life and all that.
All right.
But he shows tendencies of mental illness.
Okay.
And we can't even put it to him that he needs mental evaluation or something.
Okay.
So how do we go about, how can families or loved ones help their loved ones who are suffering from mental illness like this and they don't want to go and we can't force the person? So how do we go about it?
Pertinent question. Thank you so much for that, Sean.
Thank you.
All right. So we have scenarios like that, Dr. Akinola.
Yes.
I mean, people who you see as elites, and of course they are well-to-do, so to say, but they're coming down with some signs, and you're saying it, and because mental illness is more or less stigmatized, it's now becoming very problematic to tell the person to go for checkup. So how do we do that?
Okay, so like I said earlier, you're not going to say, I think you have mental illness. So I think you have issues, you know. Probably there are some things that are bothering you. So why don't you, let's go and see a counselor. You don't even have to tag us. Just say, I think you need to see a doctor, and just say, you know, it's not easy sometimes to talk to your relatives what they are going through. So let's see a doctor and pour out your heart. That's all. Just let's go and discuss. Tell the doctor what you are going through, how you are feeling. So, you know, so that's why sometimes it's easier for people to go to general hospitals that have psychiatric departments, teaching hospitals. So if they're going to be recalcitrant, take them to places like that. And of course, you would have informed the doctor that he or she doesn't know, but the doctor knows how to assess and ask the right questions. So please don't keep the individual at home. Encourage them.
So for Comrade Daniel, who was talking about the costs earlier on.
So, how do you... The important thing is that individuals with mental illness can be treated.
Okay.
Come in early. If it becomes complicated, so obviously the money will keep going up.
Right.
Yes. So, don't let it get complicated. Early identification and treatment. That is what we are pushing for.
Let's talk about old age now. Because when people begin to grow old, they forget, they lose their memory and all of that.
Not everybody.
Okay, some of them really.
Yes.
So, senility.
Yeah.
Is that a mental health issue?
Well, we do know that some old people, maybe from they say Alzheimer's, dementias, sometimes happen in the 60s, late 60s, although you can have early onset too. So, but the point is, whatever your relatives, your friends are going through, please don't keep them in the house. There are treatments, so many things that we can do. Let them go to the doctors, let them be assessed, then we will know the way forward. Okay, so some people can definitely start losing their memory, but it's not, you have 94 years old, so almost 100 years.
You don't want to classify that as a mental illness?
You see, for example, if it is dementia now, because of the presentation, sometimes they tend to have behavioral manifestation because they can't remember things. So they tend to get angry. Sometimes they have personality, they are not sleeping well, so they are very irritated. So for those ones, you might have to give them, low dose antipsychotics,
Okay.
Yes, so that's the behavioral manifestation of dementia.
All right. That message here says, good morning. Please, Dr. Akinola, who is it? Okay, so why is it that men hide their mental health struggles? Why do you think that is so? Deborah is sending that one in. Deborah, thank you so much for that one.
These things are cultural. This is how these men were brought up. From generations. I think it's about now that narratives are changing.
Yeah.
But that is how you are told as a man or as a boy.
Not to feel
men
pain.
don't cry. And you don't, do you agree with that?
Yes.
Those in the studio with me.
Yes,
how can you
do.
cry? You're a man. You should brace up. And, so they tend to internalize all these things and it now comes out in abnormal behavior.
Right.
A man that have issues, instead of him to come home and talk to his wife, he would rather go to the beer parlor to go and drink.
Right.
And he won't tell those friends he's drinking with. But if he has a good friend there, they will know that there's a change in his behavior and they will ask him, what's wrong with you? It's my boss at work, or I've not paid my children's school fees and all that. But how can somebody that is half drunk like you, what advice is he going to give you in a beer parlor? So we have to change the narrative. So we are saying now that we shouldn't focus only on the female child to train her. We must learn to train the boy child too. They must learn to take care of themselves, learn to cook, learn to clean, and of course express themselves and ask for help.
All right. Another message here says, good morning. Please, Dr. Akinola, why is it that... Okay, no, I think I've taken that one. This one says, happy weekend, everyone, at Lagos Traffic Radio. I am Harry. Doctor, when people hear psychiatrists, they sometimes get scared.
Exactly.
Why do you think that is so? Thank you. All right. So, why are people scared of people like you?
Because we know that psychiatry has to do with mental illness. So once they hear, that means you're telling me I have a mental illness. But that is not what we are telling you. We want to prevent it. We don't want you to break down to now have a mental disorder. So please come in early. We are doctors primarily.
Right.
So we will assess and help you. We'll talk, plan, help you. So if you have to go and see a counselor, then we know how to. We are trained to counsel too.
Right. Doctor, how many years have you been in this profession?
About 27 years.
27, that's a
Yes.
long time. So
Yes.
in these 27 years, there must be some compelling stories that you must have had.
Oh.
Any case that you can remember right now? I know there are so many, but then,
Exactly.
is there anyone
So-
that comes to mind?
So many. In what direction? What do you actually want?
Well, one positive, maybe the other not so positive due to late presentation.
Yeah, so many like that, and they come in and they do not want to. Okay, so I had a client that the parents knew there was this change in behavior. Was not talking to anybody in the house, would keep it to himself, and they just knew that something was wrong, but they were not going to accept it. So they'll come, they'll say, it's a spiritual problem. This child needs to take medication. And they'll say, no, they can't admit. They want to go home. It's prayer. I know, that there's... Anyway, by the time it became really aggressive, and that's what happens. If you don't attend to them all the time, it keeps getting worse until when the individual becomes aggressive. So at the end of the day, where you do not want to go to, you end up there.
Wow.
So middle of the night, they had to take him to Oshodi because it was totally aggressive.
Wow.
So we talk about somebody that came in, heard me talking on the radio like this.
Right.
And she took my number and came to Oshodi. This is over 10 years ago.
Wow.
And she came, she was depressed. In fact, she told me that anytime I need her to come and tell people that they need to attend to their mental health, she's ready to talk.
That's a positive story. So today
I'm telling you,
she's very okay now.
She's doing, oh Lord, what word shall I use?
Wow.
She's fine. She has gone back to school. She did her master's. She has been promoted at work. She's just enjoying life.
So she's an advocate now.
She is an advocate, and she's helping women on our streets.
Beautiful.
Beautiful. So I get excited when I see her.
That's a lovely story.
Yes.
All right. So I think that's on a very, very good note that we can round this off. But
Yes.
in rounding it off, Dr. Akinla,
Yes.
what's the message to people now that people are going through challenging times? The price of rice is pretty high.
Well,
beans, pepper, and all
tomato.
of that. Tomatoes and all of that. So what's the message this morning to our people?
Okay. So I think all of us should know that we are not alone, and that no matter how hard it is, it can get really bad. Once you get to a point, the only way it can go is to go down. So we must have faith in our country, must have faith in ourselves, and please don't keep things to to yourself. Talk about it. Make fun. If you sit there and you perpetually think about it, that is when depression is likely to come in.
Right.
So go to work and talk about it. How much is basket of tomato today? God will help us. You lift your spirit. Then, of course, that means all of us, we need to readjust our lifestyle. So what are the things that are important now?
Right.
Put priorities.
Okay.
So we know that, yes, you have to. So we learn to save more. It doesn't have to be a lot of money. If it's every day you come back, 100 naira, 200, put it.
What
And
about
so-
checking on our neighbors and checking on our people?
Definitely. You've not heard from somebody for a while, check. Then please don't keep to yourself. Nobody loves me. Nobody likes you. Everybody, we are all going through one issue or the other.
All right.
So if you have something, send a message. Just make a call, and then we will check on you.
We'll leave it at that for now. It's
Yes.
nice having you in the studios,
Thank
Doctor.
you for having me.
Great,
Yes.
great. All right, then. So this morning, I hope our message would have touched you in one way or the other. Please, there's so many things that you need to look out there and look at best ways of prioritizing your mental health,
Yes.
even in these economically challenging times. Our guest this morning has been Dr. Olufunmilayo Akinla. Doctor, nice having you in the building. Thank you so much.
Thank you.
All right, she's a consultant psychiatrist with the Federal Neuropsychiatric Hospital at the Annex in Oshodi. But peradventure, some people like to get in touch with you, Dr.
Yes.
Akinla.
Yes.
How can they reach you?
Well, they can come to Oshodi. You want me to give my number?
Well-
they won't allow me to sleep.
Okay, but once they get to Oshodi, they can always...
Psychiatric hospital, definitely.
Okay.
Or if you can give them my number, they should send a message.
All right, so you can go ahead. Give the number then.
Don't call me in the night. I won't pick your call.
Right.
080-231-76732.
080-231-76732. 732.
Yes.
That's 080-231-76732. 832.
Yes.
All right.
Don't call at night.
Just send a message.
Send a message.
All right. It's nice having you in the building. Thanks so much for being
Thank
here.
you so much.
Okay, then. So that's on that note, we'll be running things up on Talk Time this morning. We've been trying in our little way to prioritize our health in these very, very challenging times. Mike James has produced the program. Maximum shout out going out to Esther Alo, who's also in the building as well. Okpayemi Shodunke is for our social media unit, and our executive producer is Tayo Akonle. My name is Victor Oteri. I'll be back by 10:15 for Maritime Today.
I will never forget your healing hands, my love. Although my heart has stopped, swore I'd given up. I will never forget.